Radio 94.3, the first and only Filipino radio station in Qatar.
The current time is 7:33.
Time check is brought to you by Sigma Educational Consultancies, your link to worldwide and world-class education. Have a brighter and wider smile with Gulf Dental Center. Gulf Dental Center is one of the biggest dental centers in Qatar that offers modern dental services with their cutting-edge technology and facilities. You are in safe hands from start to finish. Gulf Dental Center, where beautiful smiles are created for you and your family. For more inquiries, please call 7795-6366 or visit their branches at Hilal, Duhail, Wakra, Old Airport, and Alabeb.
The current time is 7:33.
We are taking radio to a whole new level. Kabayan Radio 94.3. 3 years and counting.
3 years on the airwaves. Kabayan Radio continues to bring you closer to the music you love.
I need somebody who can love me.
To the entertainment you love.
To the information you need.
And to radio advertising you deserve.
Over analog
And multi-digital platforms.
This is Kabayan Radio,
94.3 FM.
the first and the only
Filipino radio station in Qatar. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in. Right here on Kabayan Radio 94.3.
A wonderful Tuesday evening. You are tuned in to the first and the only Filipino radio station here in Qatar, Kabayan Radio 94.3. My name is Kenzo.
And my name is Tasha. Welcome to another episode of The Doctor is In. Right now, in addition to broadcasting this program on the airwaves, we are also streaming live on our Facebook page, and you can watch us by heading on to www.facebook.com/kabayan943. And this program is also made possible by our partner, Family Medical Polyclinic.
Right, and just before we introduce our guest for tonight, I would like to quote a Colombian novelist. His name is Gabriel Garcia Marquez, and he said that age is not how old you are, but how old you feel. Ulitin ko, partner. Age is not how old you are, but how old you feel. So for my question to you who is listening or watching us right now, how old do you feel right now? Do you aspire to look and feel as if in the days of your youth?
And we're lucky today because we have a doctor, Dr. Ethel M. Cajefe, who has had 16 years of experience in the field as a dermatologist and 8 years here in Qatar. And we will be here with her discussing Botox, fillers, laser treatments, cauterization, and other skin conditions and treatments. And we will be able to take an approach, and we can consider all these different approaches to looking and feeling young.
Yes, and of course, we will also discuss how aesthetic medicine challenges people's perspective in feeling young. Once again, joining us here at Kabayan Radio Studio is a GP dermatologist from Family Medical Polyclinic, Dr. Ethel Cajefe.
Hi, good evening.
Magandang gabi po.
Magandang gabi. Hi, Tasha and Kenzo.
Thank you for joining us here at Kabayan Radio. So, ngayong gabi pag-uusapan natin about beauty, about feeling beautiful as well. So, for all the Filipinos na nakikinig sa atin ngayon, what is usually, or siguro yung unang tanong ko na, no, how do Filipinos view yung mga derma treatments?
Okay, so, well, actually nowadays, aesthetic procedures or derma treatments are quite universally accepted. So especially for Filipinas. Now, what I notice here in Qatar, marami din namang Filipinas are coming for treatments. So I think they are very accepting with the procedures for aesthetic treatments.
I see. Pero up to what extent usually?
To what extent? Yeah, you will be surprised also that Filipinos are open to doing treatments until surgical treatments, just to look young, to feel young, and even to improve their appearances.
All right.
Well, that's really amazing. And this aesthetic medicine, this field with a lot of advancements, please share with us, just briefly, a little bit of your journey and how you managed to get and to specialize in this field.
Well, it's also surprising for me because I wasn't planning on becoming a dermatologist from the beginning. My plan was to become IM, internal medicine, but of course it didn't happen. So I did my school. I studied medicine in Our Lady of Fatima University, and then I did a brief training in Quezon City General Hospital until I find my niche in dermatology, and so I specializes and studied more with this profession, dermatology.
Actually, maganda yung decision din na ginawa ni Doc, ano? Kasi you've been doing this for the past 16 years, and during this time, ito talaga yung nag-boom din eh. Yung particular industry na yun, I think there's even more money. Kumpara sa internal medicine siguro.
Actually, I was thinking of pursuing nursing and then becoming a dermatologist. I was close to going through nursing.
Right.
Instead of becoming dermatologist, because during that time, uso yung nursing talaga.
Pero dito po sa Qatar, usually when a Filipino comes in to you para magpa-check, ano yung madalas na concerns nila or ano yung mga gustong ipa-check po sa inyo?
Well, Filipinas, no? Well, most of the time Filipinas, they are really concerned about their skin. So gusto talaga nila magkaroon ng glowing skin. So basically, they come for facial treatments. Many Filipinos are also concerned about, well, noses. Very particular with nose. No? So they know, alam naman, marami nang may alam that you can do a lot of things. Marami nang pwedeng gawin sa nose na...
Akala ko sa mukha. Actually, naisip ko kasi na yung buong mukha. So anyway, sa nose po muna tayo.
Sa nose kasi, if you're not considering surgery, you can do other procedures to enhance your nose. And marami kasi sa atin, no? That's the problematic area. I mean, not problematic in that sense. I mean, they really wanted something, yung...
Just to
enhance
the
it.
popular change. So, sa inyo po, sa mga, sa observation nyo, aside from this, the change in nose and this enhancement, ano pa yung mga madalas na conditions that maybe from the weather here in Qatar, like the patients that you have coming to you for consultation, what do you see mostly?
Yeah, the most common actually is always acne. So regardless of, siguro wherever you are, it's always common, acne breakout, because we go to that stage having acne. So every now and then, I see patients or people coming for acne treatment. And then of course, yung acne, after the breakout, you get the scars, you get the pigmentations.
Biglang tumingin sa akin si Doc. Nakita niya yata yung mga, kumbaga, ang tawag dito?
Na nagkaroon ka ng acne.
Ayun na nga eh. Actually, pinaganda rin
But I think
clues. I was actually thinking of a much more proper word, which is devastation.
No, I wouldn't say it. Well, I would say that, I mean, everyone has gone through...
Because everybody, talaga.
More or less.
More or less. So, it just so happened that others are more concerned about it. Kaya they... From the beginning, they do something to stop it already. Pero ngayon, nowadays, yun nga, people are more self-conscious, they are self-aware that they can do something about it and they don't have to suffer from the consequences of acne.
Right.
And aside from that, because of the weather then, there are a lot of people is coming for allergies. The most common condition that Filipinos are having that they don't have back in the Philippines. For some reason, it's very common here, yung keratosis pilaris. I don't know if you have heard about it. But I've seen a lot of Filipinos who have that. Na before they don't have. Even ako nagkakaroon na ng keratosis pilaris. These are like, parang overgrowth ng skin, para siyang pimple.
And it's usually in the arm, right?
Usually in the arms, in the legs.
May kinaibahan po ba ito dun sa chicken skin? Or?
Para siyang chicken skin, yeah. So maraming ganyan. It's because of the change of the weather, stress-related, food-related. So, kapag ka nag-iba ka talaga ng place, I mean, if the environment is different from the usual environment that you're used to, you get these reactions, especially if under stress. So, yung most common.
I'm so interested in this because I will not say, but yes, it's very interesting. And actually, I think it's so nice to know that we have Filipino doctors able to specialize in this here in Qatar, and these concerns with which I know a lot of people, they decide to just wait till they go home. Yung pag bakasyon ko na lang sa ako gagawin. But it's good to know that there's this clinic here. So what are the other treatments also that's offered in the clinic?
Well, we have a lot of treatments, from laser treatments, from injectables, from dermabrasions or microdermabrasions. Almost everything we have naman. So any concern like laser hair removal, we also have it. Botox and fillers, cauterization, which I think everybody knows about.
Familiar with, yes.
Familiar with, yeah.
Medyo makabalikan ko lang, partner, yung acne. Hindi ako makamove on.
Sige, ito na.
Chance ko na to eh.
Totoo. Ako din yung keratosis pilaris, parang gusto ko patanungin eh.
Yun, regarding dyan sa, kasi naitanong mo na yung treatments, pero before kasi ikaw magpa-treat, di ba? There are already other approaches that you can take. Ano po yung mga kailangan iwasan or kailangan gawin para hindi na umabot sa point that you will be having an acne breakout?
For the acne breakout? Well, actually, yung acne breakout kasi, it's multifactorial. So there are a lot of reasons why you get acne. Isa na din yung hormones eh. So for hormones and then genetics. So for that reason alone, mahirap siyang iwasan because sometimes it's really genetic.
Nasa genes na talaga namin.
And then also the stress. Everything about every condition in your skin is always stress related. So yun, stress, hormones, pagiging naturally oily ng skin, and then certain environmental conditions can lead to acne. Pero just because it's genetic doesn't mean you cannot do anything about it naman.
Right.
There are medicines that you can take that will prevent you from getting breakout. Nowadays, there is what we call isotretinoin, if you're familiar with it. These are high-dose vitamin A. Vitamin A is a very good treatment for acne. We use that topically and internally or orally. So isotretinoin is one medicine that we can use to prevent, not really to prevent, but cure acne breakout.
Oh, okay. But is it safe or meron po ba itong mga side effects?
It does have side effect, kaya usually we reserve it as last option. Kasi it's vitamin A, but it's high dose. So if it's high dose, it could bear it's heavy for the liver, for the kidney, so you have to be careful about it. Kaya last option siya. So
kapag severe cases na lang.
severe cases, and if it's not reacting with topical treatments and yung mga treatments sa clinic, then that's the option.
How about diet po?
Yung diet, well, there is really no enough study that diet is related with acne. Pero
that's
if
interesting.
yeah, but if you notice that you're having breakout to certain food, then try cutting out that food. It's not necessarily that it does cause the acne itself, pero you might having some reaction. Acne somehow is din siya, para siyang allergic reaction. So if you're sensitive to this certain kind of food, it might appear as breakout. So avoid na rin siya.
Naisip ko kasi yung peanuts, sabi nila, di ba? Ano daw?
You get oily kasi, sabi, no? And it adds, kapag oily kasi yung skin, yung sebum, that's the main culprit of having acne.
Hilig pa naman sa peanut butter.
Ako din. Pero ano po masasabi niyo parang biggest misconception about acne treatments?
Misconception about
Misconception or yung nakikita mo mga fears that people tell you before they go for the treatments?
A lot of people are scared, no? Kapag sinasabi mo, you have to do certain treatments like chemical peeling, parang for them it's harsh na as a treatment. especially if they see the before and after. I mean the effect, the side effect when you do the chemical peeling. But it's in passing, hindi naman, it will pass and then your skin will become better. They are a bit afraid, scared, no, sa mga procedures to treat the acne, most especially kapag medyo invasive.
Right. Pero yung mga treatments, this was like being done decades ago, siguro mga 90s, or yung talagang piniprick yung lahat ng... you still do that?
Facial treatment, yeah, because sometimes you need to remove manually. Yung, lalo na kapag close yung pores, you need to remove it manually.
Most of the time, papansin ko po ngayon, parang hindi na ganun ka grabe yung approach compared to how it was like decades ago, na talagang pagka nagpa-facial ka at sasabihin cleaning, talagang may luha-luha kang tumutulog.
and blood.
So now you have a lot of options na.
Right.
So yun, aside from yung oral medication nga, meron ng chemical peeling. Yung chemical peeling kasi, even if you don't do the extraction, it will dry up. As I said, yung sebum yung culprit, no? So once nag-dry yung sebum, eventually mawawala din yung acne. So that's the idea of chemical peeling. And aside from that, you have other alternatives like yung mga creams that you apply. As I said, yung retinol, it's very helpful with acne. Tapos, and there are other laser treatments also that will help with acne treatment. If you're familiar with carbon treatment, this reduces also the sebum, which again will minimize the breakout of acne.
And we are actually talking right now about, treatments, and at the same time, pati na rin yung enhancements. Usually, Doc, matanong ko lang, kapag ka may mga bata pa na meron ng mga breakouts, what are the types of approaches that you provide them? Meron bang mga pwede at hindi na pwede, or hindi pa pwede sa mga bata?
We're still talking about acne, right?
Yes.
Yeah. Well, we always start, the treatment of acne is always ladderized. So we always start with topical treatments. Sa bata, kaya pa naman ang topical treatments, lalo na kapag naagapan natin, no? So we start with topical treatments, and then if it doesn't work, we go to procedures like yung facial treatments nga.
Okay.
And then, yun, chemical peeling pa rin. And then if it doesn't work, we start giving antibiotics. Kasi yung acne, there's also bacteria, so we have to halt it also with intake of antibiotic. And if everything else doesn't work, that's the time we suggest that you take the isotretinoin.
I see. It's nice to know that it's a ladder treatment, meaning like it's a progression. So you start from something small and then you move towards really dealing with the problem. I wonder if this is related because you mentioned a while ago microdermabrasion and dermabrasion. Is that different? Is one stronger than the other? Like,
Yung dermabrasion, it's dermabrasion, that's a technique they use to remove the superficial layer of the skin. Before, the dermabrasion is done by surgeons kasi medyo harsh talaga siya. Invasive treatment. Now recently, because of the progression of the technology, meron ng microdermabrasion. So this becomes micro na, so it's not very invasive at all. So there are different kinds of microdermabrasion techniques. Sometimes we use yung, if you're familiar with diamond peeling, so we use that diamond tips instead to remove the superficial layer of the skin, to remove. And another is crystal peeling. So these are form of microdermabrasions.
okay, very interesting. Is it really I have to ask, is it really small diamonds there, or is it just like a term used for this diamond peeling?
Yeah, I think it's just a term used.
So I remember once doing the treatment and I was looking for the diamond. Where are the diamonds?
Because there are crystals dun sa, on the tip of the...
It's a very nice name.
Microscopic siguro. But apart of course from acne, diba? Isa sa mga pinag-uusapan din natin dito sa program natin tonight is about people who would want to maintain their youthful looks, and at the same time, yung iba din gusto magpabata ng itsura. So, what are the treatments that people can consider to do that?
To look young.
Yeah, to look young.
To look young. Well, looking young now.
Now we're gonna get into the juicy part of it.
I feel like it's not very hard for Filipinas kasi yung genes natin.
Right.
We don't really look old, no? We don't look our age. So it's not that much hard for us. But of course, it's not for everyone. I mean, not all Filipinos look that way. So we really have to enhance. Now, the way to look beautiful is to keep on renewing your cells. Kasi the more the cells are renewed, the younger you become. So anything that produces new cells, new collagen, new everything, it keeps you looking much younger. So it's the same thing with, diba, when you donate a blood, it's helpful for you because you produce new cells, yung new blood. So it's the same thing for everything. So if you wound your face, so that's where the microdermabrasion comes in. When you, it's basically not just wounding your face, but removing the dead skin. But other treatments like fractional laser, this one wounds your face. So the wounding itself will make you produce new cells, new growth of cells, production of new collagen. So everything is new. So if you continuously renew everything in your body, not just in the face, everything, well, it will help you keep young. So those are the ideas for doing PRP or plasma. You're familiar with the plasma treatment, right? So these are all the ideas. They renew the cells all the time. So you keep looking young.
I see. Well, what about the Botox and fillers in terms of, because it's also popularly known as a treatment for, helping people look young. So my question is, is there such a thing as too young for Botox or fillers? No, actually Botox first.
For Botox. Too young. Well, actually, it's not really age related, yung Botox. Kasi Botox, it's a neurotoxin. So what it does, it paralyzes the muscle. So it's good for the lines, for wrinkling. So the moment you see any sign of wrinkling, you can already do Botox. So we have patients as early as mid-20s who's doing Botox because they notice the line. They're even doing it to raise the eyebrows. There are patients who just want the eyebrows raised a little, and you can do Botox for that. Because when you paralyze the muscle, it relaxes certain muscles in your skin, in your face, that lifts your brow or pull it down. So Botox can do a lot of things in your face.
When you say that it paralyzes the muscles, wouldn't it look weird that your muscles are not moving? Or hindi naman siya talaga halata na may hindi gumagana muscles sa mukha natin?
Depende na yan sa technique or yung sa gusto ng patient. Some patients really want frozen look, others doesn't want frozen look. When you say frozen,
terms for it.
If you overdo your Botox, kasi nga diba, it paralyzes the muscles and then it relaxes so much na nagta-tighten yung muscle mo. Everything is tight. So when everything is tight, unat na siya. So yun yung frozen look. You cannot move your muscles anymore. So, but not everyone likes that look. I don't think.
So we can like specify, for example, if we go for a treatment, we can say, I would like to get Botox, but a natural look.
Yeah. You can say that you can do that. You can also say na you just want softening of your skin. Male patients do that. They don't want kasi it's natural for males to have lines like dito sa forehead, and they don't want it removed. They just want to soften it. So you can do Botox for that. Hindi siya totally mawawala, pero magsasoften siya.
Alright. Pinapakita ko yung ako dito.
Oo nga, ako hindi ko na inaano eh. I give up. I have to go and consult with you like a long session. But I'm kind of interested. No, what's the difference between Botox and fillers? That's also for looking young, right?
They're both for looking young, but they are totally different. Kasi Botox, as I said, is a neurotoxin, while filler is hyaluronic acid. So the component, the action is different. So yung Botox, since it's a neurotoxin, what it does, as I said, it paralyzes the muscle. Originally, Botox is used for strabismus. That's the original. They use Botox. Actually, this is a brand. So the name of the thing that we inject is botulinum toxin.
Okay.
There's a specific
the
type.
chemical or-
Yeah, that's the
Ulit,
chemical. Botulinum toxin.
Botulinum
Kaya nga, this
toxin.
is a neurotoxin. So, this botulinum toxin has different subtypes. The one that we're using for aesthetic is subtype A. So, it's specific for paralyzing yung specific muscles lang where you inject it. So, it will not cause a full paralysis of the body.
Okay.
And the Botox is not just for lines. It also acts as a remedy for migraine. And then yun nga, strabismus.
Right.
Also known as yung having cross-eyed, yung ganon. And then it started there, yung Botox, as a treatment for strabismus. And then you can also use it for hyperhidrosis or yung oversweating.
Yes.
Yung hyperhidrosis. We
Right.
call that hyperhidrosis. And then for spasm, muscle twitching, there's a lot of use of
Okay.
Botox.
Yeah, that's actually really good to know, because then the people who are afraid of Botox, it's good to know that the history of it was actually to treat the pain or spasms, and as you said, like with the excess production of sweat, basically.
So apart from the aesthetic aspect, these are also being used for any other types of conditions na pwedeng meron yung kung sino mang nakikinig sa atin ngayon.
And then yun, parang it's one way to really take away the fear, no, from Botox.
It's
To
safe
know that it's
because
safe.
we're using it for not just for aesthetic.
But for
medical
these medical things.
conditions.
So, yun nga about
Curious ako dun pati sa migraine.
oh, pati or yung neck pain pwede din, mga spasms sa neck.
Parang
Yeah,
yung
TMJ is
lockjaw po yan,
lockjaw,
ano?
Yeah, lockjaw, you
So,
can use it.
parang gusto kong matulog na dito ngayon. Ang sakit.
Lahat na actually mahabang session with Doktora.
Yes. And I do agree when you mentioned na you can actually start young when you are considering having Botox. Kasi meron din akong narinig from another doctor before, and sabi niya, as soon as possible, mas okay nang magpalagay ng Botox. Kasi nga, when you age, tas mas marami ka ng mga wrinkles at mas marami ng lines, mas marami ng kailangan ilagay. And that's when...
Magagastosan ka.
And apart from mas magastos, yun na yung sinasabi natin na frozen look.
Yeah, because you need a lot. And magkakaroon din ng mga side effect. Not really yung side effect, but if you put a lot of Botox, yun nga, magkakaroon ng frozen look. Sometimes you get this, overly arched eyebrows. So, nangyayari yan kapag kailangan mo na ng too much Botox in your skin, in your face.
Are there any after effects, aside of course from the aesthetic changes, what other effects are there when one does Botox?
Other effects,
Aside from the
side
anything like
effects.
side effects that
Actually,
some people
yeah.
might be afraid of, or that you can dispel?
Yeah, actually, the good thing about Botox is that it's temporary. It's very temporary. So any side effect that you see will be gone the moment Botox is gone from your system.
Okay.
So usually 3 months lang yan.
Where does it
And
actually
usually,
go? Sorry to interrupt.
It goes by itself kasi the paralysis
As a
is
waste?
not really kasi yung neurotoxin, it will only last for 3 months. It will only react to your muscle for 3 months.
I see.
Napaparalyze niya lang yan.
Okay.
It will go by itself.
Okay.
So on the 3 month span, everything that you feel like as a side effect of Botox will go with it.
Okay.
But most of the time, ang side effect lang naman niya yung yun nga, raised eyebrows,
Which is what
bruising.
actually the patient wants,
Yeah,
right?
most
the
of the
good things
patients
that they want.
Bruising, but bruising will only last like for days to 2 weeks lang naman. So aside from that, I have not seen very drastic side effect from Botox.
Alright.
So
Very
it-
interesting
yeah,
conversation.
and it feels like anyone could actually get
Yeah.
Botox and fillers. Is
Yeah.
there anyone who should not do it? Like, are there people who should be extra cautious about doing these things?
Well, I have yet to see someone who had allergic reaction with it because I have not seen any. I don't think there is any contraindications for doing Botox.
Wow, that is actually that's really interesting.
And nagiging interesting din ang conversation natin from acne to Botox. We're gonna have more discussion later at pag-uusapan natin yung mga derma fillers and we'll go deeper on the microdermabrasion na pinag-usapan na din natin kanina and also cauterization. So,
gusto ko yan.
abangan po ninyo yung mga topics na yan maya-maya lamang. We'll just go on a very short break and then we'll be back here at the Doctor Is In once again, only here on Kabayan Radio 94.3.
Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
The best music that you want to hear. Morning, noon, and night.
The first and the only Filipino radio station in Qatar, Kabayan Radio 94.3. We are taking radio to a whole new level. Kabayan Radio 94.3. We are online for you 24/7. The people's radio station, Kabayan Radio 94.3.
Live, online, on air, and on ground. Kabayan Radio 94.3.
3 years and counting.
3 years on the airwaves. Kabayan Radio continues to bring you closer to the music you love.
I need somebody who can love me
To the entertainment you love.
To the information you need.
And to radio advertising you deserve.
Over analog
And multi-digital platforms.
This is Kabayan Radio
94.3 FM.
The first and the only
Filipino radio station in Qatar. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
Kabayan Radio 94.3. This is Tasha and with me,
Yes, of course, Kenzo, and we are still discussing about aesthetic medicine. And of course, we have here for the Doctor Is In, Doctora Ethel Cajefe. So, yeah. Kanina, just before we went on break, sabi natin, we'll be discussing about derma fillers, microdermabrasion, and cauterization. So, unahin na po muna natin, yung derma fillers. What is derma filler po?
How different it is from Botox, no? Yung question kanina. Yun nga, it's different kasi nga, neurotoxin yung Botox. This one naman is hyaluronic acid. Hyaluronic acid is a natural component of our body. A lot of hyaluronic acid is in our dermis. So, yun yung part ng skin natin just beneath the epidermis. So, naturally, we have that, especially when we are young, when we were young. So, as we age, as we grow old, nadideplete to kasama yung collagen. So, that's, because it's depleted, yun yung nagkakaroon na ng sagging ng face, medyo nawawala na yung volume. So, these fillers will come in. So, yun yung magre-replenish ng mga diminished na hyaluronic acid. So, if you have flat na yung dito mo, pwede ka magpa-filler doon. It will add plump to your cheeks. Tapos it's the same filler that you use to enhance your lips, to enhance your nose, to contour your face. So, and recently there is a new filler or hyaluronic acid, but this is different from the regular filler for plumping. Yung tawag sa kanya is Profilo. This is pure hyaluronic acid, but this one doesn't cause plumping of the face or adding volume to certain parts of the face, but it add moisture to your skin because hyaluronic acid is highly moisturizing. It holds a lot of water, so maganda siya as moisturizing agent. And aside from that, this Profilo, aside from adding moisture to your skin, it further contours your face kasi it reshapes your face. So this is newer version of hyaluronic acid aside from filler. But filler itself, yun nga, different siya from Botox because it's for volume. Yeah, for moisturizing to replenish the lost hyaluronic acid from our skin.
So when do you usually, or how do you decide whether we should go with Botox or we should go with fillers?
You can do both at the same time. Depende sa needs mo. If you have wrinkles, yeah.
Kailangan ayusin.
I have to say, hyaluronic is like my personal holy grail in terms of topical treatment. So I love hyaluronic as topical. So when it is injected into the face, I can imagine that it does give that plumpness because topically it does. How long does the effect of this hyaluronic last when it's in as a filler?
As injectable. It lasts long. Ngayon, yung mga brands for fillers, they last longer than before. So ngayon, mga 1 year, sometimes 2 years. Right? But of course, it is affected with exposure to heat. So if you're constantly exposed to heat, mas mabilis siyang,
Naglulugi pala tayo pag summer dito sa Doha.
Yeah.
Dapat lagi kang nasa loob ng bahay. Pero we have been discussing Botox at saka yung fillers. Usually pagka, halimbawa, for example, I go into your clinic and magpapagawa ko ng ganitong procedure, gaano po katagal yung mga procedures na ito?
Actually, it's very fast. It's faster than the laser procedure. Kung hindi ka sensitive sa pain, you might not opt doing the topical anesthesia anymore. Kasi tolerable ang pain yan. Especially the filler because the fillers, they have lidocaine inside. So by itself, hindi na siya ganun kasakit. So if without the anesthesia, the procedure will, even Botox, mga 10 minutes, it's tapos na yun. Tutok lang siya eh. Yung filler kasi shape ka pa, check mo pa siya, so it might take longer. But for Botox, it's fast.
Wow, that's like really, and that's like a lunch break. Like if you're in the office and then you want to go for a quick touch-up, 10 minutes, 15 minutes.
Usually po ba kapag katapos ng procedure, meron po ba siyang downtime na kailangan na tipong kailangan ba munang mag-off sa trabaho the following day para hindi...
That's the good thing about these procedures, no? Kasi injectable siya. No downtime at all. In fact, you can apply your makeup immediately. You can wash your face immediately. The only thing is that since it's injection, sometimes you get bruises. So it's up to you if you want to go to work and may bruise ka.
I see.
So,
And siguro depende sa sensitivity ng skin, no? Kung pagka madali talagang magpasa-pasa.
And that kami naman mga girls, we can cover the bruise with makeup. As you said, you can put makeup right after.
Yeah, you can put makeup right after.
And kanina natanong natin yung sa Botox kung merong kumbaga kung merong dapat mag-avoid, sabi niyo po just in case lang may allergies, but that's something that you haven't had a chance to experience. How about po dito sa fillers? Is there are there people who should be avoiding this type of procedure?
Well, recently because of the COVID, the pandemic, because of the vaccine, there is certain vaccine that when you use that vaccine, when you do filler, sometimes it reacts. Kasi they recognize the filler as foreign body. So nagkakaroon ng reaction. So if you just have to inform us what vaccine you used for COVID. Sometimes it has that reaction. Pero it's not very alarming na kasi you can take medicine na to prevent it from happening. I mean the reaction from the vaccine. So basically yun lang naman.
But almost anyone can actually
can
get
filler.
it. Wow.
Okay,
Very
wow.
interesting.
The progress and the advancement in aesthetic medicine is really incredible. Off camera, we were actually talking about laser treatments, and then I asked you about diode laser, and then you said, no, this is old already, and you even have new treatments that you do for lasering and for removing hair and whitening. What are these called? So that I'm savvy. So next time I'll be, oh yes, I know the laser, the latest in the technology.
Well, diode, these are the name of the laser they use to remove the hair. Ngayon kasi, we use na different light. That's ND-YAG and Alex. So in one machine, you have 2 lights already. Unlike yung mga diode machine, it's just that. Eto, 2 lights na siya, Alex and ND-YAG. So it depends on the color of your skin. Kasi may leveling yung laser. Depende sa color of your skin. Otherwise, you will get burned. So the ND-YAG is more specific to skin type 4, so those are darker toned. And if you're in lighter tone, you can use Alex. So very specific na siya, kaya yung effect ng laser is better.
Oh,
Wow.
interesting.
Less chance of burning as well.
And talagang alam na talagang yung pag-advance ng technology, 'di ba? Talagang ang ganda naman din ang naidudulot sa atin. At kasama na dyan yung pagpapakinis. At ito na yung pinag-uusapan natin ng microdermabrasion. Usually, or bago ako magtanong ng kasunod na question, paano muna nag-work ang microdermabrasion?
Well, we're talking about microdermabrasion. So that's basically yung diamond peel, yung crystal peel. So yun nga, yung tips are rough. So basically, ini-scrape lang yung superficial layer ng skin. So continuously, you will be producing newer cells. So
mas kikinis na siya.
Mas kikinis siya. Pero if you want deeper procedure para better treatment, mas maganda yung laser treatment. And yun na yung microneedling or laser treatment. Sa laser treatment, we have fractional laser. The fractional laser, the wound is because of the light of the fractional laser, which is also ND-YAG. So the wounding is from inside, so you heal from inside also. So nagle-level din yung skin mo, nababawasan yung scar. Yung microneedling naman is with the use of a dermapen. Yung dermapen, this is a device that has a lot of needles on the tip. And then we also use it to wound your skin. So the idea is to really wound the skin para mag-produce ka ng more collagen. So if you do this constantly, it will really help.
Actually, there are some companies that do sell the pens to the general public. Do you advise people to do that to themselves?
They do sell it here. Yung it's not the pen, not the pen itself.
They call it dermapen.
Roller.
Or,
Yeah, they sell it here, roller. It's okay. It's okay lang naman kasi mababaw lang yung depth ng needle. And then the idea is just to really wound the skin. You just have to be careful about it. And you have to throw it. Hindi siya reusable.
Okay.
Because the moment nagkaroon na siya ng bacteria, you will get infected. Kasi sinusugatan mo yung sarili mo.
Even if you try to sterilize it?
You can sterilize it siguro mga twice you can use, but you still have to throw it.
I see. And I think I'll have to confess, I bought one before coming here because I also had this misconception that I couldn't get the treatments done here in Qatar. So now I know, I don't think, I got it and it was some disposable needles. But at the end of the day, it's a lot of work to sterilize. And at the same time, the hand, of course, me doing it, it's different from a professional. So I did it in the Philippines and I could really say there was blood. But the downtime...
You cannot do it, no? By yourself na mag-bleed
I actually
ka.
have a high tolerance for pain. When we go to the cauterization later, I will tell you a story. But yes, I could do it myself, but I would definitely, knowing that there's the option here to have it done by a professional, I guess it would be easier for me. Yeah, but definitely the wounding of the skin and the blood, it does renew. There was even this thing they're calling before the vampire facial. Is this the microneedling?
This is the plasma.
Plasma,
This is the PRP treatment.
which you also offer.
Yeah, we also offer that one. So this one naman, we get blood and we take the plasma out and we re-inject it on the area that you need to. So you can do it for the scalp, para for
hair growth.
hair growth.
Okay.
Those who are suffering from hair fall. For the face then, for regeneration pa rin. So we use it in a lot of things. The plasma is also very good for other medical conditions din Kasi as I said, the blood itself, diba, it has healing power by itself. It has a lot of growth factors. It will help in regenerating your cells. So they use it for a lot of medical conditions. mga arthritis or certain conditions that needs regeneration of the cells.
Interesting.
Wow, even arthritis.
Mhm.
Ano pa po, Doc? Aside from arthritis, I'm so curious
The
about
PRP?
this. The PRP, yes, about the plasma.
For me, it's actually the
The
hair.
hair,
Ang
actually,
concern.
yes. Oo nga.
Nagkakating kay Cody. Wala akong
Huwag tayo mag-ano. Yung mga receding hairline na yan.
Pero sa lalaki yun talaga eh. So,
Yan ang concern basically. Mostly males, receding hairline.
So going to the laser treatment, one of the things that most people want to do is to have the fractional laser. When I go to your clinic and I would get this kind of treatment, usually gaano po katagal itong treatment na ito?
Well, it's also fast. Mabilis lang ng fractional laser, siguro around 15 minutes to 45 minutes, and you should be done. However, if like we do additional treatment, like sometimes we do subcision together with fractional laser to enhance yung healing ng skin. We do this for secondary healing.
Okay.
It will take longer time. Pero at most, mga ganun, 30 to 45 minutes.
Kasama na po dun yung paglalagay nung, kasi may anesthesia yun.
Oo, kasama na.
Alright, alright.
And you mentioned, what is this subcision? What treatment is this?
Subcision, it's an additional wounding for the skin. Susugatan mo pa yung skin para more collagen production. Still, these are for scar treatments.
Ang galing, talagang susugatan ka para kuminis ka.
No pain, no gain.
Yung body natin has the ability to
Heal
heal
itself.
by itself. So that's what we're
Trying to... Yeah. And yung downtime naman po nito, so gaano po katagal ang downtime?
nung fractional. The fractional laser sa face, it will take 5 days before you see good result. Kasi you will have scabs. Ano kasi to it's basically burning your skin with the laser. So you will have scabs all over your face. So this will be there for at least 5 days. There are some patients who are sensitive to it, so it lasts like longer, maybe 1 week. Pero mga ganun lang yung
And then may mga redness din,
basically scabs So
I see.
red for a while and then medyo nagiging brown.
I see.
And can you wet the face?
You
during this
cannot
time?
wet it for the next 24 hours just
Okay.
to avoid infection.
Actually, that's the reason why, from what I've heard, and I don't know whether this is true, that during the pandemic, many people were trying to undergo a lot of aesthetic procedures kasi nga naman, nasa bahay lang tayo
True.
lahat. So kahit ano yung magawa mo, kahit
No
gaano katagal ang
worries.
downtime, sa bahay lang ako magre-relax ako. Totoo po ba yun, Do?
Well, nag-close yung clinic for some time ng pandemic. Ng pandemic.
But when you reopened,
Yeah, when we reopened, there's a lot of patients. Yeah.
Lalo na working from home pa at that time.
There's a
lot
wave
of
of patients.
That's so, actually, isa din sa mga treatments na maraming downtime na sabi daw nila uso ng pandemic, yung cauterization din.
right.
Because I know this has some downtime. Around how many days usually?
Sa face, ganun pa rin, around 7 days. Pero when you talk about the body, kasi yung body, yung healing niya is much longer than the face. So around 2 weeks. But the scabbing for cauterization is more obvious than fractional laser.
Pero before we go deeper into the topic, I would like to know, what is cauterization itself and saan po natin ito ginagamit?
Okay. Yung cauterization, it's removal of certain growths in the skin. So yung mga benign growths, small benign growths in the skin in the form of warts, skin tags, sometimes you have lentigines, yung mga dark spots then we have those dark spots, we can all remove it with cauterization.
Is this something that is common to the Filipino skin?
The
Yung mga warts, yung mga...
yeah, they are very common. Very common, not just with Filipinas but all around.
Okay.
It's basically a viral infection kasi. So it's very contagious, so you get it from other people. But the good thing about warts, it's benign lang naman siya. There's nothing to worry about except if you're conscious about your appearance kasi it becomes big. Sometimes it increases in number. So that's where people get concerned about the looks. Kumakalat.
Kasi sabi
Sa
mo
face.
daw it's viral.
viral
Through the
infection.
air, or is it more of contact,
Contact,
or
yeah.
towels? Can you
Indirect,
also get
yeah,
it from-
indirect contact. So if you touch someone,
Or the doorknobs,
or the doorknobs,
elevator
like that.
buttons.
If somebody is borrowing your makeup or yeah,
Okay,
they
makeup
have
brush,
wars,
these
yeah.
things.
And
Okay.
the procedure of these, paano po siya?
The procedure also, of course, anesthetic cream, and then basically it will last also fast. Kung konti lang naman yung wards, it's a very fast procedure.
Totoo po ba yung sinasabi na sinusunog po yung
Sinusunog,
curtains?
basically
So
sunog.
cauterization is basically sinusunog yung curtain.
Sinusunog siya, yeah. We use this a lot in surgery, yung cautery. Kapag ka nagka-cut ka sa surgery, nagka-cut ka
Right.
ng body, we use it to clot the blood. Kasi kapag ka overly nagkakaroon ng too much bleeding, we use cautery. So that's the same thing we use. So you don't have bleeding when you remove the skin tag because it's basically clotting the blood.
Pero pagka mga ganyan po na-cauterize na, for example, is there a risk that it will, recur? Or hindi na talaga babalik yun?
Difference depends on your exposure again dun sa mga tao na merong warts, or if your immune system is really low, you easily get these infections.
Okay.
So, yeah.
And
Sun exposure also.
Yeah,
as
how
well.
long does
Exposure
it-
as well. Oh.
Yeah.
how long does it take to heal?
The
Cauterize.
around 7 days, like that, for the face.
Experience. So gusto mong i-share
Oh yeah. Well, because the doctor said, I went for cauterization, and then the doctor said, I don't think you need anesthesia. It's fine because it's just a couple. It's painless. So I sat there and I didn't know at the time, and I trusted the doctor. So we started doing it, and I started shaking because it was a bit painful without
It is
anesthesia.
painful,
But you know
yeah.
what? After a while, I got used to it. And so now, when I go for cauterization, sometimes if it's just a few, I don't go for the anesthesia anymore.
Oh,
I
wow.
can tolerate it now.
Wow.
After
Ang
that
taas ng
experience.
tolerance sa pain, ha?
It's because the anesthesia takes around 15 to 30 minutes, so it takes away from the waiting time. Yeah. My question about cauterization is because some doctors have said to me before, you can wet your face after 24 hours, and some have said no, you have to wait 3 or 4 days.
Oh, wow.
So which one would do you recommend for your
You
patients?
just need 24 hours without washing.
Okay.
The thing is, you just want it, you don't want infection because it's wound kasi siya eh. It's a burn wound. So basically you cannot introduce anything that is not sterile. So you cannot use regular water when you wash it. Pero it will only take 24 hours kasi mabilis ang healing.
Right.
It heals fast, so it closes easily. So you don't need to wait for longer days before you can wash your face.
Okay. And I
Alright.
remember being given antibiotic as well.
You have to use antibiotic, but all these are topical lang.
I see.
And of course, itong mga pinag-uusapan natin ng mga treatments, mga procedures, the Botox, dermal fillers, microdermabrasion, cauterization are all available sa Family Medical Polyclinic. And siguro ang pinaka gustong itanong na din ng ating mga listeners, ng mga ating mga viewers, how much, Doc, will this cost?
Which one?
All of them. I'm sure that all of them are interested to do that, to avail of that, treatments.
Well, I'm sure you will be very interested to know that our clinic, the Family Medical Polyclinic, has a very good heart for Filipinas. And they give special price for Filipino. You just come and visit and we will give you really special discount.
Kasi depende rin talaga sa sa concern.
Ah.
So I think it really has to be kumbaga walang specific rate na pwedeng ibigay.
Yeah.
Kasi depende kung gaano ka tindi.
Based on personal experience, that's
Injection.
true. And it's also your rapport and your connection with the doctor. I think that is so important when you go for aesthetic medicine and the
yeah.
trust. So I think that's one thing. But the range of prices, just to give our listeners or viewers just an idea of kind of the range.
Yeah, it depends on what's your concern basically, no? Pero we have treatments ranging from 200 to 1,500 to 2,500.
Okay.
Okay. How about, Doc, yung fractional laser? Kasi di ba, this would be standard naman, I believe. For yung per session po,
Per session. Yung fractional laser, it's 350 per session. But we
That's
do
actually
give...
a very good rate.
Yeah, it is. But we do give special price, like may mga promotion prices, like if you get 4 sessions, it's a different price. If you get 6 sessions, it's different price.
Actually, the price that Doc is saying is similar to the prices back in the Philippines.
I know. Because we actually follow the Philippine price because we wanted more Filipinos to come for us.
That's so good to know. Yeah, that's good to know that you're... Where can we find these this information for the name of the website? What's the best place to look for the promotions that you have?
For the promotions, I think it's available in
The Facebook page.
Facebook page,
Okay.
Family Medical Polyclinic, Instagram. We're always updating the social media.
Okay.
And we will also be posting, I believe, on our video, maglalagay tayo dyan ng information about the phone number of their clinics. So at least you can call them. You can book for an appointment. You can get to meet Dr. Ethel. So I'm sure mas marami kayong malalaman about the treatments that you can have. But right now, matanong ko lang po ulit, Doc, for my final question, is there any kumaga final na suggestion ninyo, final na reminder on how people can look and feel young?
Okay. Well, as I said, as you said also a while ago, looking young is not just, you have to feel it. You have to feel it. And it's somehow mindset also. But don't be afraid also to go to clinic to do dermal procedures because all of it are safe. As I said, you have to keep on doing something to renew your cells. So it's not just about dermal procedures, it's also about eating right, eating the right food, keeping yourself out of stress, staying happy, I think, and then surround yourself with happy people as well. All in mindset, and plus, of course, you have to come and visit the clinic because we offer a wide variety of treatments that will help you look young.
All right.
All right, I love that. Thank you so much for being so patient with us, for answering all our questions so knowledgeably, and I felt the trust. Like whatever reservations I had before this, I definitely feel confident to try and to go for several treatments actually.
Several naman. Kanina parang isa lang.
There's just one. And then
Before
at
we
the end
started
of
the program, parang isa lang.
dumami talaga. Kanina Catherine, ngayon dumami na. Ano po, please, is there anyone you would like to acknowledge, you would like to greet?
Hello to my Family Medical Polyclinic family and to Gulf Dental Center family, to our very supportive bosses, Mr. Muhammad and Dr. Mahmoud, for giving us this opportunity to inform the people about the procedures that we offer for everyone, especially the Filipino community.
All right. Is there anyone whom you would like to greet? Mga friends, family members?
All my friends and family.
This is your opportunity na to.
May dalawa lang akong pamangkin dito. Hi to John Regine, and Renzo.
All right.
Okay.
Thank you, Dr. Ethel M. Cajefe, of course, of Family Medical Polyclinic, for joining us here in the studio. And on behalf of Kabayan Radio, I would also like to thank Family Medical Polyclinic for making this episode of The Doctor Is In possible.
It's really been such a pleasure to be able to speak to you and to speak to an expert on how to maintain our youthful appearance, and also to get all this interesting information about how aesthetic medicine is also helping with so many other aspects, such as pain and different treatments that people get. So this has really been amazing. And
Can I also thank Robilyn for being here and supporting us?
Robelinda Guzman,
Yeah.
the very beautiful and classy lady behind the camera.
Pakita ka daw sa camera later.
And of course, our RJ Cody behind the
Yeah.
scenes. And I would love to quote a Swiss physician, Paracelsus, who said that medicine is not only a science, it is also an art. It deals with the processes of life which must be understood. And I can say that today, after our conversation, it has really been a privilege to learn more about aesthetic medicine and the possibilities that are available to us because of the advancement and because of the expertise that having these treatments here available, gives us and makes is available for us Filipinos here in Qatar. So thank you, and thank you for joining us here. Thank you. This has been really great. My name is Tasha.
My name is Kenzo of Kabayan Radio 94.3, and as I always say, stay safe, keep smiling, be blessed.
Thank you.
Thank you.